let's talk about the ligaments of the ankle joint. Now, in the ankle joint, you have a lateral complex and you have a medial complex. In the lateral complex, there are total 3 ligaments, and in the medial complex, there are in total 4 ligaments which are present, which are together called as your deltoid ligament. Now, let's look at the lateral complex ligaments first. So, firstly, you have your anterior talofibular ligament, posterior talofibular ligament, and your calcaneofibular ligament. Now, one thing that you need to remember here is all the connections which are present, or the ligaments which are present in your lateral complex, is the connections between your fibula and your talus, your fibula and your calcaneum. So, as the name suggests, anterior talofibular ligament, that means it's present anteriorly and the connection is between the talus and your lateral malleolus of your fibula. So the proximal attachment will be your lateral malleolus of the fibula, which goes forward and attaches onto the neck of the talus. Your second one, which is your posterior talofibular ligament, the attachment will be present posteriorly, and that will be between again your talus and your fibula. So the proximal attachment will be the malleolar fossa of your lateral malleolus of your fibula, which goes backwards and attaches onto the lateral tubercle of your talus. Third one, which is your calcaneofibular ligament, as the name suggests, again the connection is between your fibula, that is the lateral malleolus of your fibula, and your calcaneum. Now this will be present with a proximal attachment to the tip of your lateral malleolus, comes down and attaches onto the lateral surface of your calcaneum. Let's look at the functions of these ligaments first. Firstly, your anterior talofibular ligament, it is one of the weakest ligaments amongst all the other ligaments which are present in your ankle, and it is the most frequently injured ligament also which is present in your ankle. The function is to prevent the anterior displacement or the forward displacement of your talus. Similarly, your posterior talofibular ligament, it will prevent the posterior displacement or the backward displacement of your talus. Third one, which is your calcaneofibular ligament, that helps in stabilizing your 2 talofibular ligaments, and secondly, it helps to prevent inversion in your calcaneum. Now let's look at the medial complex ligaments. So as I said earlier, there are 4 ligaments which are present in your medial complex, which is your anterior tibio-talar, posterior tibio-talar, tibio-navicular, and tibio-calcaneal. So again, as it's there in the name itself, you need to remember the connection is between the tibia and your talus, tibia and your navicular, tibia and your calcaneum. Because your tibia is a medial bone, so it has connection with all the other tarsal bones. So the names of the ligaments are, first one is your anterior tibio-talar ligament. Its function is to prevent excessive plantar flexion and eversion. Secondly, your posterior tibio-talar ligament, which is present posteriorly there. The connection is between the tibia and the talus, obviously posteriorly, and its function is to prevent excessive dorsiflexion. Third one, which is your tibio-navicular, the connection is between the tibia and your navicular bone, which is one of your tarsal bones. And the fourth one, which is your tibio-calcaneal, which is the connection between your tibia and your calcaneum bone. Both of them helps to reinforce the ankle joint.